Hi everyone. On the 7th of April 1948, the World Health Organization defined health as the complete state of physical, mental and social well-being, and not just merely the absence of sickness, diseases or infirmities. Is the world in good health today? In this video, we will be taking a closer look at COVID-19, how countries respond globally. We'll be looking at this from the Asian perspective. According to the World Health Organization and Johns Hopkins University, Asia currently have 534,195. The number of deaths in Asia is thought to be around 18,964, and the total number of recoveries in Asia is thought to be around 275,905. To start with, the first country on our top heated list of top 8 countries in Asia is Iran. Iran currently have total number of confirmed cases to be 95,646. The total death in Iran is 6,091, and the total number of recoveries is around 76,318. COVID-19 has plunged Iran into the country's biggest crisis since its war with Iraq. More than 20 years on, the lingering effect of the war is still currently shaping Iran's reaction to the global pandemic. COVID-19 is putting unprecedented strain on Iran's already fragile, heavily sanctioned economy, and further exposing domestic political disagreement amid ongoing international tensions. Iranian government's response to COVID-19 has been sluggish and poorly managed. During Iran's New Year holidays, the government took action to slow the spread of the virus by discouraging travel and shutting down schools and cancelling Friday prayers. On the 4th of April, Hassan Rouhani finally took action after receiving permission from Supreme Leader of Iran, Ali Khamenei. Rouhani withdrew $1 billion from Iran's National Development Fund and started distributing the money through loans and credits to 23 million households. Aid from a number of Iran's parastatal agencies was also announced. US sanctions on Iran have significantly weakened Iran's economy and limited Tehran's ability to purchase much-needed medical supplies and equipment.
Iran's health sector say sanctions have indeed made it difficult to import much-needed supplies.
متاسفانه اثر که میذارن، به هر حال ما نیازهای زیادی به دارو داریم. امیدوارم که یعنی یه کمکی بشه که این تحریم‌ها برداشته بشه.
At this Tehran pharmacy, the lead pharmacist says sanctions have made it impossible to purchase vital medicines.
یعنی تحریم‌هایی که امروز گذاشتن، حالا آمریکا برای ما گذاشته، بدون شک اون چیزی که اتفاقات مردم دارن در واقع تاوان این داستان رو میدن و قشر ضعیف.
The Iranian government has also been unable to access its foreign reserves due to the sanctions. The Rouhani government has now applied for a $5 billion loan from the IMF. Hopefully, the Iranian authority will be able to put in place a robust infrastructure to be able to fight this global pandemic. Number 2 on our list today is China. China currently have 83,959 confirmed cases. The death is thought to be around 4,637 and recovered cases of 78,573. The origin of COVID-19, as we all know, is from Wuhan, China. In China, local and central authorities were not only slow to react to the early report of the mysterious new pneumonia-like illness, which is now COVID-19, but they even took steps to cover up the news. People issuing warnings on social media. One of those is Dr. Li Wenliang, who later died from the virus. When this doctor issued the warning, the Chinese authority arrested him and he was locked up. This led the pandemic to spin out of control in the crucial early stages. this has also misled the rest of the world, including the World Health Organization, into downplaying the severity of the problem. After initial missteps, the Chinese government moved swiftly to prevent the spread of the disease, instituting an unprecedented quarantine in Wuhan, where the disease was discovered. Although this was done with a combination of high-tech scanning and tracking of its population, coupled with strict controls of people's ability to leave their homes. There are intense questions over what the real numbers are for both case count and death toll estimate based on external data, such as back-of-the-envelope calculations based on funeral homes, output of cremated remains, which will put death toll in Wuhan, China to around 40,000. The origin of COVID-19 is Wuhan, China. However, this origin has been increasingly contentious, with the US and other allies suggesting that China has not been transparent about the origins of the outbreak. Donald Trump, the US president, has given credence to the idea that intelligence exists, suggesting the virus may have escaped from a lab in Wuhan, China.
Have you seen anything at this point that gives you a high degree of confidence that the Wuhan Institute of Virology was the origin of this virus?
Yes, I have. Yes.
US intelligence community has declined to back this up. The scientific community says there is no current evidence for this claim.
Wuhan, China, a sprawling city of 11 million people. It was here that coronavirus, our invisible, brutal enemy, was born, festering at least a month and a half before the world was told. Wuhan, mid-November, and first cases of a strange new flu start surfacing. From early December, Chinese authorities say the new virus has arisen from a local live fish and animal market. They're adamant it's not SARS or anything like it. Anyone who suggests otherwise is suppressed. On New Year's Eve, an official announcement. The closure of the wet market has stopped the spread of the disease, and there is no evidence of human-to-human infection of the virus. But as you'll see, that was not true. It was Dr. Li Wenliang, the whistleblower who first tried to warn the world.
I'm sure history will record Li Wenliang as the hero of this entire pandemic. He recognized that he was seeing people with a bizarre form of pneumonia. He got into a chat room and said, "I think this looks SARS-like." So he posted this. That triggered every alarm in the system. So all 8 of the physicians, including Li Wenliang, were brought before the equivalent of a hospital tribunal and compelled to sign statements declaring themselves liars and that rumor mongers. And they were officially chastised, but they continued working, treating patients, and of course we all know Li Wenliang died as a result of COVID at the age of 34.
Independent newspaper based in Beijing, which uncovered shocking behaviour by Chinese government officials. It reported that testing labs that had cracked the code and identified the mystery flu as a new coronavirus strain were ordered to hand over or destroy their samples. They were not allowed to release their findings.
2 laboratories in Wuhan, China, studying bat coronavirus have come under the spotlight. The Wuhan Institute of Virology, which is a biosecurity level 4 facility, and also the level 2 Wuhan Center for Disease Control, which is located not far from the fish market where the COVID-19 originated. World Health Organization and scientific communities have stated that the current origin of the virus, like other coronaviruses before, is simply spread to humans via a natural event. It is still unclear the source of this global pandemic. Hopefully, China will be transparent with the rest of the world and unveil the true source of this global pandemic. Next on our list is India. India currently have 37,257 cases. The death is thought to be around 1,223, and the total recovery is 10,007. Since March 24, India has been under a nationwide lockdown. Now this has been extended to the 3rd of May to curb the spread of this global pandemic. The government gave 4 hours notice before the lockdown.
A sea of people amidst the coronavirus pandemic. Hundreds and thousands of migrants desperate to reach their homes in rural India. They converged at a bus terminal in Delhi as the state of Uttar Pradesh sealed its borders. Men, women and children have walked for many miles, crossing state after state in a lockdown.
हम यहाँ पे दिहाड़ी मजदूरी करते थे, काम बंद हो गया हम लोगों का, और खाने के लिए भी पैसे नहीं है, और पॉकेट में 100-200 रुपए पड़े हुए हैं, अभी कैसे पहुँचेंगे ये मुश्किल की बात है।
The government failed to factor in such a rush while locking the country for 21 days, giving just 4 hours of advance notice.
Despite government directive for all public and private labs to test for free in India, some private labs are still charging around $59 to get tested.
We are winning. We need to test, and test. But not every Indian can afford it. This isn't fair on millions of fellow citizens. Make COVID-19 tests free to ensure that we stay free. India fights coronavirus, a Times Now campaign.
An overstretched public healthcare system forces millions of Indians to turn to the unregulated private healthcare sector. The Indian government's expenditure on health as a percentage of GDP still hovers around 1.5%, one of the lowest in the world. The faith in the public health system cannot emerge immediately as a response to the pandemic, said Giridhara Babu, head of life course epidemiology at the Public Health Foundation of India. Hopefully, the government of India will be able to put in place a robust infrastructure to be able to curb this global pandemic. Number 4 on our list is Saudi Arabia. Saudi Arabia currently have total number of confirmed cases to be 24,097, and the death is thought to be around 169, and the total recoveries is around 3,555. Saudi Arabia has taken the deadly coronavirus outbreak seriously from day one. Before the kingdom had even recorded a single case of coronavirus, Saudi Arabia had banned foreign worshippers from performing pilgrimage in the holy city of Mecca. On the 26th of April, Saudi Arabia and China signed an agreement of $265.3 million to deal with the global pandemic by providing the kingdom with 9 million COVID-19 tests to fight the global pandemic, according to the Saudi Press Authority. Clearly, the government of Saudi Arabia is on top of the fight against this global pandemic. Hopefully, this will reduce the spread across the country. Moving on, our 5th most heated country in Asia is Pakistan. Pakistan is thought to have total number of 18,114 cases. The death is thought to be around 417, and the recovery is around 4,715. The government of Pakistan has taken unprecedented steps to counter the effect of COVID-19 crisis, but it is unclear if this will be enough given the challenges facing the country prior to the pandemic. COVID-19 has already surpassed the death toll of the more recent outbreaks. Pakistan spends 2% of its GDP on healthcare against a global average of 10%. On the 6th of April, A number of doctors protested in Pakistan, and this led to a number of arrests. The government of Pakistan has unveiled $6.76 billion rescue and stimulus package. Some of this will be funded by support from the World Bank and Asian Development Bank. Currently, Pakistan is in partial lockdown due to its fragile economy, and it has imposed a number of curfews in different parts of the country. Hopefully, the Pakistani authority will be able to put in place a robust infrastructure to tackle this global pandemic and reduce the spread in the country. Next on our list of the top heated countries in Asia is Singapore. Singapore currently have total number of confirmed cases of around 17,101. The total death in Singapore is 16, and the recovery is thought to be around 1,268. Singapore's response to the coronavirus has been held up as one of the best in the world. There has been no lockdown in place in Singapore. Businesses, churches, restaurants, and schools continue to stay open. The first thing that helped with its response was that it was ready before the outbreak. Because of the SARS outbreak of 2002 and 2003. Singapore was aware in its infrastructure that it wasn't ready to fight this kind of outbreak. But since then, a number of isolation hospitals were built, more negative pressure rooms were created, and legislation was put in place. On the 31st of December, when the world first became aware of coronavirus in China, Singapore started to get prepared. By the time the World Health Organization declared a public health emergency at the end of January, Singapore was ready to tackle the global pandemic. And clearly, Singapore's strategy has been very effective so far, up to reducing the death rate in the country to just 16. Number 7 on our list is Israel. Israel currently have total number of 16,101 confirmed cases. The death is thought to be around 225, and the recovery is around 9,156. In March, Israel was not only concerned about its domestic struggle with this pandemic, but also the outbreak of the virus in neighboring countries like Jordan and Egypt. High infection rates and death tolls in those countries will represent a major threat to the stability of their regimes. It will be devastating for Israel to have additional fronts to shield, on top of Gaza to the west and the Syria to the north. On the Palestinian front, Israel is stuck between a rock and a hard place when it comes to addressing the pandemic internally and preventing it externally in the West Bank and particularly Gaza. Some analysts propose that Israel should explore ways to assist the Assad regime and the millions of refugees in Syria with medical supplies and expertise. Overall, the pandemic's impact on Israel's regional situation is not clear. So far, Israel's regional landscape has not changed drastically, and it has been able to control the outbreak domestically. Indeed, one study of global pandemic data has ranked Israel first in terms of COVID-19 related safety. Hopefully, the Israeli authority will see a way to continue to put in place a robust strategy to fight this global pandemic. Number 8, and the last on our list, is Japan. Japan currently have 14,305 confirmed cases. The death is thought to be around 455, and the total number of recovered cases is 2,975. Despite Japan recording its first case in mid-January, the number of both confirmed cases and fatalities remains significantly lower than many of its peer countries. The country were due to host Summer Olympic, but it has now been postponed to 2021. The postponement is a blow to the host country, which has spent more than $12 billion on the event already, while huge sums are also at stake for sponsors and broadcasters. Goldman Sachs estimated that Japan will lose around $4.5 billion if the Olympics did not take place as planned.
The Olympic climbing test event is underway in Tokyo, but there are no spectators. The climbers are staff from the Games organisers. For weeks after the start of the coronavirus outbreak, Japan insisted the Olympics would be held as planned this summer, but few people agreed. The decision to postpone them for a year came as a relief. But the move has come at a huge cost, with Japan looking at an additional bill of between 3 and 5 billion euros, on top of the 12 billion euros already spent. The organisers must pay its 3,500 employees for another year, and for the upkeep of sports venues, including the 1.2 billion euro Olympic Stadium, the Games' gleaming centrepiece. Executives at Fuji TV, one of the Games' official broadcasters, try to put on a brave face, but the postponement has turned their programming schedule upside down.
Japan's relatively restrained approach to testing COVID-19 has frustrated its citizens, especially as neighboring South Korea makes a massive push with drive-through tests. Japan has run fewer tests because the Ministry of Health, Labour and Welfare initially chose PCR testing not as a medical procedure. Japan has struggled to contain the outbreak. The ministry has now decided to change its approach, treating testing more as a medical issue, and decided to cover testing costs under the public health insurance program. Hopefully, the Japanese authority will continue to implement this testing approach and ensure that the citizens get tested, and also ensure that robust infrastructures are put in place to curb the spread of the global pandemic in the country. This makes up our top 8 list of the most heated countries in Asia. Moving on to other news, the world has been scrambling around to seek a way to find a cure to the global pandemic.
Tonight, for overstretched health workers, families torn apart, and shuttered businesses, a glimmer of hope. A group of scientists at the UK's Oxford University says a vaccine could be closer than has been predicted, maybe even ready this year. We spoke to them as they prepared for trials.
If you can have a vaccine in the next 6 months, it makes those other measures that many of us are suffering from at the moment, being isolated and not being able to interact, more worthwhile if there's an end in sight. And I think there is.
6 months is much quicker than the time most have warned it will take.
That is going to be at the earliest a year to a year and a half, no matter how fast you go.
The faster timetable, they say, is because their vaccine has been in development for decades in an effort to stop other coronaviruses. Now it has been adjusted for immunity against COVID-19 and tested on 6 monkeys at the Rocky Mountain Laboratories in Montana. After exposure to the virus, they report the monkeys did not get sick. And earlier versions of the vaccine have already been tested in humans.
We have a good idea of what type of immunity it produces.
Meanwhile, manufacturers are getting ready. Millipore Sigma in Massachusetts telling NBC News they're preparing to scale up production of the vaccine and make it faster. If more trials are successful, the first batches could be ready in Europe by September.
How many doses of vaccine do you think you can make?
We are aiming to make not millions, Probably not tens of millions, but ideally hundreds of millions of doses of this vaccine.
To talk about the cure itself, have you heard the commentary from the United States of America's President Donald Trump on how best to cure COVID-19?
You brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute. 1 minute.
And it has been widely condemned across America and other parts of the world. Some of the citizens are also confused if taking a bleach or drinking a bleach could be a cure, could serve as a cure to combat COVID-19 pandemic. They've been contacting their National Health Service to ask that question, but unfortunately, the answer is no. No one is encouraged or advised to take a bleach to cure COVID-19. Moving on again to other news, I want to give a big shout out to Anthony Joshua, the British-Nigerian heavyweight boxer who recently visited Nigeria and has decided to give back to the community.
In 2019, I visited Nigeria, and some of the local places I visited were places like Makoko, Shagamu, the Shrine. We was planning on teaming up with some of the local community leaders to contribute towards their events, but due to the global pandemic, these plans had come to a halt. So during this crisis, we thought it would be best to put some basic necessities together for some of the local people who may need it.
Joshua for giving us rice.
Really appreciate Anthony Joshua for the gift.
Thank you, Anthony Joshua. God bless you so much.
People appreciate you, Joshua. Keep boxing, keep winning. Up Africa, up Nigeria.
So here's to Nigeria, one love people, and I'll see you soon.
Thank you so much, Anthony Joshua. Every little helps. That is it on our episode for today. If you are yet to subscribe to this channel, please kindly do so as more videos are coming your way. Thank you so much for watching. Bye for now.